Good afternoon. Welcome to another episode of Awaaz in Focus, a part of Azaad Awaaz. Azaad Awaaz is a monthly patrika that focuses on the marginalized sections of society, whose voices are often muted in the cacophony of flashy mainstream media discourse. When referring to marginalization, this platform does not aim to restrict itself to the traditional focus on social aggregates like caste and race alone, but inspires to include a discussion on class, gender, identity, environmentalism, representation, etc. In this issue of Azaad Awaaz, we would like to focus on a gendered understanding of migration and document stories of its impact on women and children within the institution of a family. The Patrika will focus on various reasons for their movement, the kinds of vulnerabilities they face, and would try to understand whether rural urban migration exposes migrant women and children to better socioeconomic opportunity or traps them back into the vicious circle of poverty. Therefore, for Awaaz in Focus, we would like to understand existing and emerging data on gendered perspectives of family migration and look at migrant women as major economic actors while also examining questions of health and employment. We would also look at the rights of migrant children and examine the lack of implementation and accessibility to educational and health policies. Today, we have with us Dr. Dipa Sinha, who is an assistant professor at the School of Liberal Studies, Ambedkar University, Delhi. Before joining the university, she worked with the Offices of Commissioners to the Supreme Court, Center for Equity Studies and Public Health Research Network, and is actively involved with the Right to Food campaign. She has done her MA in Economics from JNU, MSc in Development Studies from the School of Oriental and African Studies, London, and her PhD from Jawaharlal Nehru University, New Delhi. She has also worked on issues related to food rights, nutrition, and public health. Ma'am, we are very glad to have you here with us today. Moving on to our first question. While most people migrate in the hopes of bettering their lifestyles and well-being, the process of migration is fraught with obstacles, and it's prone not only to structural or even cultural constraints, but also limits migrants' potential options. It also takes a toll on their emotional and psychological well-being, and this is true especially for rural women who have been understood to migrate largely as a reaction to the socio-economic and political conditions of their places of origin. Do you believe that this type of distress migration aggravates their situation further, with migrant women struggling for housing and sanitation? Do you think migrant women are armed with the ability to assess disparities in opportunities at home and their places of work in the urban sphere, make informed decisions, specifically considering that their position within the unit of a family?
Yeah, so just breaking up this question into parts, I think first when we begin talking about migrant women, what we have to understand first is that who are these migrant women that we're talking about. So a typical view that we might have of a migrant woman is a woman migrating from a rural area to the city in informal sectors such as construction and so on. While this is a very important group and a group that I will talk about, when you look at the data, firstly, what you see is that there is a large section of migrants in the country, the way they're defined, which is that you're living in a place which is different from your place of birth. Then 2/3 of the migrants in our country are actually women. And the main reason why women migrate is because of marriage. So this thing of women being dislocated from their place of origin is something that is in our country where patriarchal localities followed in many parts of the country, which is that mostly marriage happens in a village which is different from the place of residence. It is something that most women in most parts of the country undergo as a part of the life cycle when they get married, when they have to leave their place of residence. And that also exposes them to various kinds of vulnerabilities because they are away from their natal family, they're away from the kind of social support that they've been used to, and they have to adjust to this new place. While that set of migrant women have a whole different set of issues, like I said, who we talk about more in this context that you just laid out for us is women who migrate for work. And even in the cases of women who migrate for work, women migrate for work either with their family or alone. the bigger proportion is women who are migrating with their family for work. I think it would be about 4 crore women, and even urban, rural to urban could be from to a big metro city, it be to a smaller town and so on. So firstly, when we would like to understand migration overall and especially migration of women, we have to understand that it is not uniform. It's not homogeneous across all kinds, all women. Women migrate for different reasons, and women migrate to different kinds of destination places. While there are vulnerabilities associated with almost all kinds of migration, they're not the same across different women. When we look at rural to urban, which is the kind of migration which got most exposed during COVID, especially during the first national lockdown, when we saw thousands of men, women, and children walking long distances, trying to go back to their places of origin, which is, I think, in many ways how the whole migrant issue came into the center and into attention in this recent time period. We see that this is largely women who belong to families who are largely landless or have very small amounts of land, where agriculture is not paying them sufficient returns, and the rural wages have also not really been increasing or keeping pace in the last many years, because of which they move to urban areas looking for work, mostly find work in the informal sector in areas like construction. A large number of the women, for instance, in Delhi, who were part of this group, were working as domestic workers largely in other people's houses. They're women who work as are self-employed. They're working in their own homes, doing home-based work, and so on. So when we look at this set of women, and of course within these migrants also there are migrants, so-called circular migrants, which is that they have one foot in the village and they keep coming and going. Often a lot of construction workers are like that. And you also have a large number of migrants who are long-term migrants, who have come to the city, and the city becomes their main base. All of them face, like I said, many vulnerabilities. And one of the things that we did see is that is housing in very big cities. Again, in a city like Delhi, one reason why they had to go back was this whole issue of that they were living on rent and they couldn't even afford rent, because as soon as the lockdown happened, the men and the women lost their jobs. Like I said, most women are in domestic work, construction work, and in the lockdown, these were the sectors that were most affected. So they immediately lost their work. The men in the household also lost work. They could not pay rent. That was one reason to go back. But even without the lockdown, when they're living, you look at the conditions of living, you find that there are new kinds of pressures that come largely on women, which is to a big extent also to do with the lack of public services. So obviously, when they're migrating from the village to the city, somewhere the wages in the city are better than the village. I mean, that is why they would stay on, because the opportunities in the village are almost not there. But at the same time, in the city, the kind of living in some ways it increases the pressure of unpaid work on women much more because of the living conditions and the absence of public services. Something that is there in rural areas also, but that's in more familiar, maybe sometimes in safer spaces. But for instance, there is no piped water in most of the slums and the settlements that informal sector workers live in big cities. So the fact that they have to queue up, wait for the tankers to come, or pay for private water resources, the fact that there are no toilets, and that even when they use common toilets, which is now at least becoming more available, there is a risk involved when they have to go far away from home. There are no street lights, and so on. So these are things which are added kind of risks that women face when they move to the city, because their living conditions are so poor. The other areas also childcare. So again, in a village, I mean, the burden falls largely on the mother, but the kind of work that they do, they're often able to take the child with them. They have extended family and so on. But in the urban areas, we see many instances where women are leaving children alone at home, or really are not able to do the kind of jobs they would like to do because they have young children. So number of public services being absent increases the burden and makes migrant women in cities much more vulnerable.
I think this makes a lot of sense, and it's kind of connecting to the question that we were going to ask you next. So, um, right now, with especially in light of the pandemic, kind of making it very obvious that there are a lot of gender inequalities and vulnerabilities within migrant families in the city, the government has come up with a lot of initiatives like the PDS, Manrega, and the most famous is the eShram portal, right? And many female migrant workers have been engaged in industries where there are very few legal protection for worker rights. For example, commercial surrogacy, which has again made it to the mainstream media in the last few years. This is one area where migrant women are kind of migrating to urban spaces in search of quick, fast, and a huge sum of money. And this also exposes them to a lot of coercion and exploitative working conditions, right? Because they're again employed in low wage jobs such as domestic work services and other construction, manufacturing, or the garments industry. So, and the national database also lacks any substantial findings on the gender dimension to rural urban migration. How effective do you think the government's efforts are in introducing labor and migration legislation in sectors where women kind of dominate?
Right, it's a good question. And again, to look at that, I think related to the point that I was making previously as well, that just as migrant women are not homogeneous, women in the labor force are not homogeneous either. And understanding the vulnerabilities of women in the workforce and understanding the laws that exist to support them through social security or laws related to minimum wages and so on, we have to look at also all women in the workforce and not just migrant women, because that kind of gives you the base protection that women workers have, and then you can look at what additional things that migrant women specifically would require given the vulnerabilities that we discussed. So when we look at the data in India, we see that 90% of the women in the workforce are in the what we call the informal sector, which automatically takes them away from a number of protections that labor laws offer, because many of our labor laws are related to men or women, workers being in some sort of a formal sector, even if it's not a formal job. If you look at the Factories Act, you look at the Maternity Benefit Act, and all of these acts have now been merged into the 4 labor codes. They are looking at people employed in enterprises, and usually enterprises, and it is defined as those which employ 10 or more workers at least with electricity and so on. But if you look at the profile of women workers in our country, firstly, a large number of them are not counted as workers at all. So the labor force participation rate itself for women in India is extremely low. It's around 20%. Even of those women who are counted as workers, more than half of them are self-employed. So there is no clear employer-employee relationship for most of the workers, women workers who are counted as workers. So many of our labor laws and various social protection measures are based on this employer-employee relationship, because the mandate is on the employer to provide minimum wages, the mandate is on the employer to provide maternity leave, to provide creche services and so on. But in a context where you have most women working outside this kind of sectors which are covered under these labor laws, then you need something. We need to imagine social protection and labor legislation for women quite differently, given the context of the kind of work that women in our country do. In the case of migrants, this becomes even more amplified, because like we discussed, migrants particularly largely work in these kind of sectors, domestic work, for instance. For long, we've been trying to regulate domestic work, but it's very difficult because that woman is working not in one house, but in multiple houses for doing different tasks in different houses. So it's very difficult to pin down responsibility on, there is no written contract, there is none of that to pin down responsibility on the employer on what the woman is eligible for. So not to say that therefore the employers do not have a responsibility, but like I was saying, I think we need to think of it in a very different way. So if we look at the government programs that currently exist, talking about social protection first, I think one of the ways to look at it is to move away for the basic rights towards, say, food, education, health, and so on, is to take a universal approach and to see what is required to bring in migrants, people who are not originally from wherever they currently live. So if you take the example of PDS, for instance, the public distribution system, that has nothing to do with where the woman is working and whether she's working or not. But we find that a large number of migrants are still left out because having a ration card is often linked to having residence proofs and showing that you belong to a certain place. And often in places like Delhi, for instance, it also requires you to show that you've been living there for at least 5 years, right? So you need a valid address proof, which is for a certain period of time. It also links to the kind of housing vulnerability we talked about. So if they have to show the electricity bill and show proof that they're living in a particular house, it's very difficult for them to produce that because they're often living in rented accommodation, which is not fully legal in the sense the owners also don't really own the houses that they're renting out, so they're not willing to share any papers. So all this documentation requirement makes migrants much more vulnerable in accessing social protection, which is also meant for everyone, which is not to do with the labor laws that we were talking about. And there again, women are more vulnerable because we know that women I mean, the burden of providing food often falls on women. Even if there's no cash, they are the ones who really worry about feeding themselves and feeding their children and feeding the entire family. They are the ones, if you go to a PDS shop, you'll see them queued out in Delhi, anywhere, who are really struggling to get their rations and make the ends meet. And documentations, compared to men, women have even fewer documentations. So there is that issue. The other issue is how do we have even social protection like, say, maternity entitlements and so on, which are clearly related to workers' rights, but where there is no employer identified, then what is the role of the state? So like you mentioned, the e-Shram registration now. So we see that the registration is happening, but we still don't know what that means in terms of entitlements for women. Will they get a maternity benefit? Will they get a maternity benefit equivalent to 6 months of wages, which is what a formal sector woman would get? These are all still open questions, and the new laws that we have, for instance, the Social Security Code and so on, also still do not address these aspects of women in the unorganized sector. What is the kind of labor protections and social protection that they will get? So there's a big gap there still. And most of our labor laws neglect migrants, and then women migrants are just not there in the imagination of migrants when we look at our policy and law.
Ma'am, also speaking about the whole aspect of violence and exploitation, there's also a lot of data on migrant sex workers within in the country, right? And they are more prone to diseases such as HIV, and there's also there's a significant female sex worker mobility, especially in the borders of in South India, in Maharashtra and in Karnataka. But there's no emphasis on this kind of migration, and there's no emphasis on the violence and exploitation they face, especially coming to urban cities where they don't have homes or dwellings, and they're not open about the kind of work they are involved in as well. What do you think can be done to mitigate the kind of health crisis that they are prone to, and also the in terms of violence and exploitation, including from the state and its instrumentalities of the police and other such bodies?
Thanks for bringing this up, because when you mentioned commercial surrogacy and the migration related to that, this is something that came to my mind as well. So there are a large number of women, like you said, who work as sex workers, and we are using the term sex workers because we are recognizing them to be workers, but that's not what the state does, right? The state is not recognizing them as workers. In fact, they try to illegalize their entire existence in so many ways, because of which it's not just the absence of access to these various, whatever available protections that are there, but also that they have to face additional harassment even from those who are supposed to protect them, the police, for instance, or the various officials and so on. The sex workers unions themselves have also been demanding for long that they have to be given identity cards and they have to be given access to these various services as much as anybody else. That brings me also back to the point I was trying to make last time, that certain services have to be universal. No, they are rights. Like there is a right to health. All of this would be encompassed under the right to life with dignity. There is a right to health that every citizen of India has. There's a right to education. There is a right to social protection. There's a right to food. And these cannot and should not be linked to where a person is employed, what their occupation is, or any other kind of demographic factors. I mean, I think if we accept that as a principle, we at least move closer towards including people from these various marginalized categories, sex workers, homeless populations in urban areas, many of whom are migrants again, and various other kinds of occupations who are excluded, where there is some kind of taboo attached to their profession as well. While that is a bigger problem and that which needs to be addressed, I think at least as far as these basic rights are concerned, the demand has been, and I think it's a very valid demand, that these are universal. So children of sex workers or any other child, when that child goes to an Anganwadi, does not have to show address proof or anything else. It's a child under 6. That child should be registered in an Anganwadi center. Growth monitoring should be done. Nutrition should be given. A pregnant woman, whether she's a sex worker, she's a home-based worker, she's a domestic worker, construction worker, whatever, a pregnant woman is pregnant and she doesn't have to prove anything else to show that she is eligible for a certain service. Currently, that's not the case. For everything that the government provides, you have to show a residence proof, you have to give Aadhaar. Till very recently, till in fact just a couple of months back, even to get the maternity benefit under the Pradhan Mantri Matru Vandana Yojana, you had to show the Aadhaar not just of the woman but her husband as well. So again, imagine here women like sex workers, if she's pregnant, she doesn't get a maternity entitlement because she has to produce a husband and an Aadhaar card of the husband. Whereas what is the entitlement? It's very clearly the woman is pregnant and giving birth to a child. The child needs exclusive breastfeeding, and that is why we are supporting them. So understanding the principle of universality behind these laws. And universal, of course, then does not mean uniform. Because we have many things which on paper are universal, but we still know that there will be some groups which will be excluded even when you say universal. So you start from a position of principle of universality, and then you look at who are the people who are not being included even when your services are universal, and what additional efforts can you make to bring them in. Like in the case of sex workers, you might have to give some kind of identity cards. You might have to go out of your way to get them into this e-shram registration. You might have to think of pension schemes for them. There are different kinds of things you would have to think for different sets of workers, which are currently not in place. And once again, in the case of migrants particularly, another issue that we really have to think about is the portability of entitlements. So for example, if a woman comes from the rural area and says a construction worker and is coming to the city for 4 or 5 months and is pregnant, part of her pregnancy is in the city, the other part of her pregnancy is at home. In fact, even if the woman is just going to her mother's house for delivery, then the first 6 months of her pregnancy, she's where her residence currently is, and then she's going to her mother's house to another location. Even she is a migrant. Now, these women often are slipped and they don't get access to the service because they are told you're not a resident of this area and these services are only for people who live here and you have to show us some kind of a proof that you live here. But the services are actually related to that stage in her life cycle. It should not matter where the woman has been living the previous month or where she's going to live the next month. If she is pregnant now, she needs supplementary nutrition now. She needs the iron tablets now. She needs the checkup now. And that has to be given again, like I said, as a universal service. So delinking requirement of documents and address proof from these basic services would be the first step, which we currently do not have. And particularly specifying portability in all of this, that a woman or a child would get these services irrespective of where they are, even if they are at different places at different points of time, that they can get it. Even a child, if a child is going to the Anganwadi in Delhi for 6 months and then say some village in UP for 6 months, the midday meal in the Anganwadi can be given in both places. There's no reason to think that is some double benefit to the child. A child will eat in only one place, right? If the child is eating khichdi here, then nobody's eating that khichdi there in UP. So we should not get into that theme of this being a wasteful expenditure or there being any corruption. There is also the issue of whose citizens are they. I mean, often state governments say, why should we spend? They are not our people. No, but they are people of this country. Even if they were not people of this country, these are basic human rights. So it really shouldn't matter. Even citizens, I would say, residency is what matters. If they're here, if it's a woman, if it's a child, you have to provide these basic services.
I think especially during the first lockdown, there was a lot of emphasis on what you just said, whose citizen are they? Because people from Delhi would walking to Madhya Pradesh, Uttar Pradesh, Rajasthan, and all of these state governments said they're not our responsibility, they're your responsibility. And there was just a pointing of fingers, right? So that mass exodus, there was pictures of like pregnant women walking miles and miles together. There were women carrying toddlers, and there were little children also doing the walk from back to their hometowns. And as you had previously mentioned as well, even within the city, they usually live in small makeshift houses in urban slum settlements where there's little to no sanitation and hygiene facilities. And there's also been a lot of evidence that highlights the health risks that are posed to both rural children who have been separated from their parents who migrate to urban settings, and also children who accompany their parents to cities and having to live in these overcrowded colonies with no hygiene healthcare facilities, right? So in this situation, do you think it's enough to promote socioeconomic development in rural areas and ensure that migration is reduced in cities in the long term? Or do you think this is a feasible solution to this whole issue of migration?
See, I think we need to do both. We need to look at the long term. We need to look at the overall development model, which is causing this kind of increase in migration. And at the same time, while we try to address that, we also need to look at the conditions of living of migrants currently. So clearly, this is a very valid question, what you posed on. Why do we have such migration? Is this the only way, path to development? And there are, I think the pandemic kind of, once again, it highlighted the fault lines in the kind of development that we're currently having, which is highly unequal, which is not creating employment. That is at the heart of the problem, right? That the problem that there is a structural transformation in terms of output, in the sense that agriculture is reducing and manufacturing, and much more than that services are contributing much more to the GDP. But these sectors are not creating good quality formal sector jobs like they were expected to do. So when this employment is not being created, people are being pushed out of the rural areas and they're coming to urban areas in search of opportunities. So this question definitely needs to be asked, that is it sustainable that we keep growing where the GDP grows but people are not getting employment, where the profits grow but wages are not increasing, where some people's incomes are growing but on the other hand you find that even the quality of diets of some other people is actually reducing. I think that is something that we really need to ask ourselves, and economists have been talking about it, that it is not necessary that this is the only way growth happens, that we need to shift our priorities. We need to think about a labor intensive, employment centered growth, which might mean a small decline in your percentage of growth in GDP, but it might actually mean much better quality of lives for a large number of people. I think we have to keep that in focus, and we have to keep raising that question. In that new kind of path to development, I think public services would also play a very central role. It would be, I mean, how do we get onto that path? One important role would be played, I think, by the government providing universal public services, which not only would play a role in kind of reviving the economy, it would play a role in improving human capital. It would also provide a role in reducing these inequalities. Right now, if you look at schooling, for instance, there's such a huge gap in the kind of schooling that is available to children belonging to different classes. Also, what you mentioned about children being left behind, or children having to come and children having to keep moving all the time. All this also happens because we don't have a system where we might have a Right to Education Act, but we still don't have a system which actually ensures that every child under 14, no matter where they are, no matter what their conditions are given access to an equal quality education. So a different development path, also keeping in mind how in that path itself, you don't again make people who are vulnerable and marginalized pay for this development, which is what we keep hearing, that this is temporary and that everything will be fine when we have growth. But having a growth itself, which is something that takes along people, is something that we really need to think about. And that, like I said, has to be one where universal free public services are very central. So provision of healthcare services, provision of education services, even something like the Rural Employment Guarantee Act, if it really worked well, if it really did provide employment on demand, if it paid wages on time, if it paid minimum wages, then so many people should not have been migrating. Given the fact that even when you demand work, you don't get it on time, even when you work, your wages are not paid for a number of months, it's because of these reasons that people are having to leave the rural areas and come into the urban areas, right? So therefore, that is something that we need to definitely think about on how you stall the migration, and how you stall the migration should not be, the objective is not stalling migration, but the objective really is improving people's quality of life, which automatically will people will be happy staying where they are. At the same time, we need to also recognize that urban areas are growing, and we have to think about what kind of urbanization we need. For instance, housing is something we discussed. We don't have a clear, we talk about smart cities, but what is the vision for housing for the poor? Let's remember, when we say poor, most of the poor in India are working poor. They're not people who are doing nothing, right? They are working, but they're still poor and they're not able to afford housing. So what is the vision we have in a city for these people who come to work? What is the vision we have for, say, single women who come to work? That is also beginning to now increase, where we talked about issues of safety, violence against women, and so on. What kind of safe spaces are being provided for these people who actually make the cities run? You need them, right? At the end of the day, you need all these workers to make the cities run. So in this vision for smart city, where do they fit in? What are the spaces that they have? These are also questions that we need to ask and plan for. Better public facilities in housing in areas where the poor live, having piped water, having toilets. I mean, basic things that one is talking about, nothing really out of the, nothing out of really basic services also, which we have not achieved. So I think broadly, if I've got your question right, it's not an either or, it is questioning the larger question of what kind of development, and at the same time addressing the immediate needs of migrant workers, not just in urban areas, but in rural areas as well, where we have, say, farm labor going from Bihar to Punjab. What about them? What about rations for them? What about schools for their children? These things also need to be put in place.
Yes, ma'am, that makes a lot of sense, especially as you're talking about education. So again, when we're talking about socioeconomic betterment, especially in terms of defeating the current structure, the institutional mechanism, the institutional backwardness that is currently prevalent, often the answer is that education is the most effective tool towards socioeconomic betterment. But with mobility being a constant factor in the lives of migrant children, who are often from, as you said, families who have been categorized as the working poor, it is very important that we understand that educational exclusion is in line with the constant conflict that is posed by their mobility. So even with the engagement of both government and various NGOs, which have kind of tried to reconfigure syllabus and try to bridge the learning gaps amongst migrant children, there's still an inadequacy which and it fails to meet the particular needs of these children in some areas of education. So this also, there's a lot of evidence that shows that this has a cross-generational effect, and it continues to harm each generation of a migrant family. So what do you think about this? Do you think that they're trapped back into the system, and how?
See, absolutely, education is very important, and like I was saying, education is one of the areas where inequalities really begin. I mean, as long as we have these very unequal school systems and access to education, it's very difficult to break these intergenerational cycles of inequality. And in the case of migrants, especially circular migrants who are spending different parts of the year in different places, this has been an issue. But like you said, there have also been some very good examples of people trying to address this issue, both in the government and through NGOs, where they've had, say, residential schools like Odisha's in their high migration districts. They have these local kind of hostels in the village where children can be left back when the parents go to work for a few months, and they continue to go to school. You have these mobile kind of schools that are run in brick kilns, for instance, There are issues here. There are issues of language. It's a big issue. So there have been experiments where a teacher travels with the group of migrants from the local area. So they're able to speak that language and continue education in that language. So once again, if you really care for every child's education, I think solutions emerge. There can't be one standard solution. It would also change by the age of the child. Slightly older children can be left behind in residential accommodation. Younger children, it might be best for them to go with their parents. It would depend on whether there are grandparents or not who can take care of the children. So that would change, and I think that amount of flexibility should be provided. But at the same time, there has to be a micro planning for every single child, which also relates to one of the other points you have raised on the issue of the lack of granular data on migration, on even knowing who are the people who migrate with families, who have children, who are the children who go and come, and keeping track of every single child at least, and ensuring that they don't slip because of this. Because there are small scale experiments that have worked, we know that there are all these models. It basically just needs to become routine policy where you have the data on every migrant and you're doing whatever works there. You're either doing a bridge course, you're sending a teacher with the group, or you're having a hostel locally. Probably you would need a bit of all of this. But it is really, like you say, if you don't do that, what you're doing is that family is in that vicious cycle, right? The next generation is also most likely going to be again not educated, again in the informal sector, not having the freedom to escape from that kind of drudgery. So equipping them with all the resources would really again be the basic thing to do.
Okay, thank you so much for this, ma'am. I think we received a lot of information, especially with respect to gender, and I was not aware of these small-scale experiments that were being carried out. But it sounds very interesting and I hope to a certain level there's the largest implementation, which makes a small tiny impact at least on the structural system at place right now. Thank you so much for doing this conversation with us.
Thank you.
Thank you.